Thank you, Thomas. Uh, the topic which was given to me by Dr. Rajiv was OT etiquette. But now the question is about quality. Whatever you do, it should be of top quality to the patient. And the major share of quality of our services is contributed by the surgical outcome, and that is from the operation theater. So I thought it's better to rephrase my talk like prime yourself for the sanctum sanctorum of your hospital, which is the operation theater. And you should learn the concept of zoning in an operation theater. That means we have got 4 zones in any operation theater, starting from the outer zone, that is a protective zone, the clean zone, the disposal zone, and the aseptic zone. These are nothing but different zones of varying microbiological count, so that it reduces the unproductive movement of the staff, the materials, and the supplies, and the patient. And thereby, we will be able to reduce the extent of hospital-acquired infections. I must confess that this is not from textbook. This is purely from my experience. What you ought to learn from the operation theater. I've broadly classified it into 3 heads. One is to pick up the right attitude, to know the routine work in the OT, and how to improve your skills to become a good surgeon. And the attitude comes punctuality, know your team, you have to take care of the patients. There are certain do's and don'ts in the theater, and you have to be very careful about your language. So all these things you'll have to master in the first week of your OT session itself. And the next is the routine works that go on in the theater, or the hand hygiene, the OT dress, the checklist, various checklists that we have used in the theater, what are the sterilization methods in the theater, and how the waste is managed in the theater. And finally, to improve your skills, you have to know the procedure, you have to start assisting surgeries, then you have got wet and dry lab training these days. And finally, you will muster sufficient skill and courage to start doing the surgery. We'll take it up one by one. See, punctuality is very important for a doctor. I would say for a doctor, they should be punctual. And you have to develop that habit. See, for habit, people say that the word habit, you remove the H, a bit remains. You remove the A, bit remains. You remove the B, still it remains. So you develop that habit so that by the time you become a good senior consultant, you will have that punctuality in you. And if the scheduled time for surgery is 8 o'clock, the postgraduate should reach the ward at least half an hour before to ascertain the latest status of the patient, and you can brief the consultant about that. That would definitely pick up an impression of you in the consultants. They will realize that you're there to you mean business. You're not come as a spectator. You have to pick up the right attitude. For that, the team that you are working with. That is not only the surgeon, the assistants, the staff nurses, the technicians, even the housekeeping staff. All of them form the team. So you should develop the habit to greet them when you come, to communicate well with them, and to acknowledge their services when and where possible. Next is how to care for the patient. Everybody cares for the patient, but there are certain small things which you may think is negligible. But see, nowadays we give a shoe cover or foot cover for the patient. That is a plastic thing, and the patient will be walking on mostly very slippery floor, very shiny floor, and there is a chance of slipping while wearing this plastic thing on a smooth floor. Just place your foot in front of the patient, in front of the feet of the patient when the patient comes down from the OT table, or just gets up from the wheelchair. This will avoid slippage. It's not a great thing, but still this means that you are caring and you have got concern for the patient. And about the language, see, most of the surgeries that we do are under local anesthesia. The patient is fully conscious, and since they don't have any vision, the other senses are uh, tuned to receive the impulses. So they will hear everything, So all communications between the staff and the surgeon and the assistants, all communication should be professional. And maintain your calm and composure in adverse events. Don't scream. Don't just say, oh, ah, ouch, ayo. All those things that will convey a very bad impression, and the patient will get frightened. And another thing is that once you start doing surgeries, don't be temperament. A bad, if you get shout at your assistants or just show temper tantrums, this mood is highly contagious. You will spoil the entire mood of the operation theater. So that will reduce your performance. There are certain do's and don'ts in the theater. You should never come fasting. Usually people come skipping the breakfast. That should never be done. Your stomach should be full, but your bowel and bladder should be empty. Avoid unnecessary movements in the theater, especially in the sterile zone. And when you are standing for something, especially when you are assisting a surgery, you should shift your weight from one leg to the other to reduce a chance of postural syncope. And never show haste in the theater, especially in the recovery room and all those things. If you are running through the recovery room, patient will get frightened. So never, do not show haste in the OT. This is the sterile zone I mentioned. See, the head end of the table, that is the most sterile zone. So you should never cross this space between the trolley, or don't try to watch the surgery standing here. You can stand here and you can watch the surgery in the monitor. And don't bring any mobile, books or newspaper, etc. in the operation room. And do not bring eatables in the OT. And do not touch sterile surfaces with unsterile hand. Do not lean onto surface, because all these surfaces are considered unsterile, even though you have disinfected that surface, but that is considered unsterile for a person who was draped for surgery. Do not open the hand with gloved hands, because even after surgery, if you're opening it with the gloved hand, you're going to contaminate that surface, so that the next person is at danger. Do not keep multiple doors open while the surgery is in progress. Here also, do not drop articles on the. Sometimes after some few weeks, you will be asked to take a sterile thing, transfer a sterile thing onto the trolley. So do not drop it on the trolley like this. Instead, the scrub nurse should take it outside the border of the trolley like this, with the gloved hand or with a artery forceps. Like this, when you are transferring fluid, saline or betadine or whatever, it should be transferred outside the trolley. And this is one which is very common in the theater, but it should never be used in the theater. It is not at all advised. And if it is unavoidable, you should always autoclave it and store it dry, and not put it in a Dettol or Savlon solution. Next is hand hygiene. Hand hygiene, the routine unscientific hand wash will leave so many areas untouched. So we'll come to that the next step. And this is a nail brush. It's called a nail brush, and it should never be used in any other part of the forearm or hand. It should be used only to clean the nails. This is the accepted standards for surgical hand wash. There are 6 steps which you should follow, which is described in the European norms. The OT attire, when you are entering the theater, all staff, all the doctors, assistants, the housekeeping, everybody should change out to the OT dress completely. Remove all jewelry, and your arm should be bare below the elbows. Avoid free-flowing robes. It should be comfortably fitting. You have to clip the nails short. Avoid bindi, kumkum, sandal paste, etc. on the forehead. And never put OT clothes over street clothes. And you should not develop the habit of pinching the nose over the mask. You should change to normal clothes before going to toilet, and wear the cap and mask properly. This is the talk of the town nowadays with the corona. And the mask should cover the entire aspect. The sides, the top, and the bottom should be covered well when you are wearing the mask. And you should learn the proper way of donning and doffing the surgical gown, and the types of gloving, and how to the posture attained after properly donned. This is the open. There are three types of gloving methods. One is the open gloving. Here also you never touch the outside of the gloves with the bare fingers, so that you once you hold the folded part of the glove, and then after putting on the fingers, the other hand also is other glove also is applied without holding the outer surface. Here is a closed gloving where the fingers are within the edges of the cuff. Here also you will not touch the outer surface of the gloves. This is an assisted gloving where you can slide the hands into the glove which is kept open by an assistant. After properly putting on the gloves and the surgical gown, you should never fold your hands like this or fold it down like this. You should hold it in the namaste posture, sufficiently away from the mouth. That is the correct posture that should be attained. There are several checklists that are maintained in the theater. You have to study the checklist, and you have to start running the checklist at various stages. Most important is to verify the patient, the eye, and the surgery that is to be done. Then you have to learn the steps of surgery and record surgical notes meticulously. This is the routine checklist that we use in our hospital for the nursing personnel, checked by the nursing personnel. And this is the pre-operative checklist that we use. And this is the surgical safety checklist that we use. There are a lot of checklists which you should be aware of. Then in the OT routine, this is a very important topic, the sterilization. You should know the basics of sterilization, how your instruments are getting sterilized. The most common is the steam sterilization, which is used for heat resistant articles. And for heat sensitive articles, we use the ethylene oxide and the plasma sterilization. Then we should know whether once the cycle is complete, we should know whether the items are sterilized or not. For that, there are several indicators, the chemical indicators, the biological indicators, and then the air sampling and the culture of the air. Then you should know how surfaces are getting disinfected at the end of the surgical session or at the end of the week. These are just a list of chemical indicators that are available. There are about 6 indicators available. Right now, they are coming out with a 7th indicator, chemical indicator. And this class 1 indicator is very commonly seen. It comes as a roll and it is affixed on all the packs, but just mentions whether it is the pack is processed or unprocessed. This is a class 2 indicator, which is used, is otherwise called a Bovidic test pack, which is used to assess the amount of vacuum that is created in the sterilizer, the autoclave. This is the class 6 indicator, which is otherwise called emulators. This is the best available now. This has got a stated value, and if the autoclave attains this value, this color, the yellow color, will turn to blue. Then you will know that your items are sterile. But the best is the biological indicator, where a large number of resistant bacterial spores kept in this container are processed along with the autoclave load. At the end of the process, we'll send it for culture. But I mean, if it grows organisms, then your cycle is not proper. But it takes time. Then next is about the waste disposal. There are different color-coded containers. This is for infectious clinical waste, the yellow one. The red one is for infected clinical waste. And you should know how these items are segregated at source. And there are other the puncture-proof containers for sharps. This is for sharp metal and this is for sharp glass. And finally, you have to improve your skills, know the procedure fully. Then you start assisting your consultants. But for assisting, you should know the next step. You have to anticipate the next step. For that, you know the surgical steps well. The hand should never cross the surgical field, and the instrument should be handed over in an ergonomic manner. Replace the instruments. Suppose you give a forceps to the consultant, he gives it back, and it has to be replaced in the correct place. Because if he asks for it again, otherwise you will be groping around if you don't locate it properly. And most important, if you feel dizzy, inform and leave the operating field. Otherwise, you will produce an embarrassing situation, dangerous situation. how to learn surgical steps? There are a lot of options available. There are dry labs, the wet labs. There are several gadgets available like this, which are useful for dry lab settings where no tissue is used. In a wet lab setting, you can use the goat's eye or the pig's eye or even cadaver eye to learn the important surgical steps. And as Dr. Thomas mentioned, you have to maintain the correct posture right from the beginning. Better to use a microscope with a tiltable optics. And always learn to do surgery through the microscope, never under the microscope. Because the usual tendency is that you just switch on the illumination and then start doing surgery beneath the microscope. That should never be done. And as I said before, never show panic. Even if you create a PC rupture or if you have a dropped IOL or a dropped nucleus, don't show panic. You call your consultant. He will come and manage it. Don't shout there. Don't scream there because the patient will get frightened. And never ever hesitate to stop your surgery if you find difficulty. Then you call your senior. He can come and do the surgery and do good for the patient. And finally, the one important thing is that you should not be a spectator in the OT. You should not just see, you just observe things, just like Sherlock Holmes. And this is just one small example of how observing things will make it better. This is the suturing technique, just a demo of two gauze pieces. Once you pass the suture, the initial position is prone position of the hands. Once you pass the suture through both the edge of the wound, the hand comes in the supine position. But then after that, you have to re-grasp the needle, and that should be grasped not in the supine position, it should be grasped in the prone position, because otherwise you'll find it difficult to take the needle out of the wound. So this can be picked up early by a keen observer. If you just watch the surgery without observing, you will not be able to pick up all these small points. And to conclude, there are slow learners and fast learners in surgery. Never get disappointed. Don't say that my colleague, he has picked up surgery fast and he is doing it fast. Don't get discouraged at this. There are people who are very slow, but they will pick up later. And always be positive. And more important, be proactive in the operation theater. And you have to start now during your training period. Enjoy your life as an ophthalmic surgeon. Thank you.